Good day. John Dombrowski here, Washington Pain Center here in Washington, D.C. As you know, I have a great interest in treating addiction and helping patients with sobriety. I'm an anesthesiologist, and actually my main practice is pain medicine and management. This majority is related to injections and other medications that aren't opiate-based. But unfortunately, sometimes I do see patients with opiate-based issues, and needless to say, they were given these medications appropriately, but for whatever reason, kind of got in trouble that the medications didn't work or they were using them inappropriately. But needless to say, also, these patients now are in a box. They still have a chronic pain issue, and now they have an addiction issue. With this, I've kind of looked at changing my practice in terms of helping patients with addiction. Now, these patients might be, again, as formerly mentioned, patients who are using medications appropriately, but then kind of got in trouble. The other patients might be just simply recreational or other issues that, depression, life happens, they started to use, and they started going down this really bad rabbit hole that they couldn't get out of. So medically, what are we going to do for these patients? Obviously, there's methadone treatments, Suboxone treatments, things like that. And those are all very fine, techniques and very good medication management. But again, sometimes you're just using one medication to treat another medication, and I could see the choice in that, but is there something else that can be done? Well, at least 10 years ago, maybe a little bit more, there was a thing called auricular nerve stimulation or peripheral nerve stimulation. And auricular just means the ear. Okay, that's the auricular. This is based on Chinese medicine with respect to auricular acupuncture. This was actually discovered by the French. It was a Jesuit priest who were proselytizing to the Chinese, and this was in the 16th century. They actually wrote books about this in terms of certain points on the ear that cause certain issues in terms of calmness, relaxation, things like that. Well, needless to say, given 21st century technology, we've now been able to map out certain areas of the ear that have definitely electrical or neurochemical points of interest. So what are we going to do with these points of interest? So about 10 years ago, there was a company called Dianesis, and they came up with this stimulator. It's called a peripheral nerve stimulator. That's what we were using it for. And I will show it to you best I can on the video. So it had a little computer here and a battery. You can see the little batteries there. And each these little devices, the little circle there, you could kind of see here, and one here, and one here, were placed on specific ear points. One up here perhaps, one down here, and one down here. Then this would then loop around and give you stimulation for a couple of days. What did this actually do? It really did tremendous benefit with respect to anxiety and anxiousness and inability to sleep or inability to relax. So a lot of patients with chronic pain issue, and especially with addiction from opiates and or alcoholism, have that problem. So what we're now doing is being a bridge between your last use and to your sobriety. But a lot of patients can't make it because they have tremendous anxiety, tremendous nausea, tremendous sympathetic overdrive I have to use to calm down because my body is going through physical withdrawals. So I could certainly give you medications to do that, which is what you would do. Or perhaps we can use this peripheral nerve stimulator to help. Well, as anything, in America, the company has redeveloped it and has come up with a better product. And so we're now offering that here at the Washington Pain Center for treatment of addiction. Again, some insurances do cover this. Obviously, it might not be a covered charge, but a lot of the patients really do find this to be tremendous help in terms of getting their sobriety together. A lot of it, they just can't make it from here to there. This is that bridge to help the patients with their chance of sobriety, because usually they can't make it, hence they relapse, and then we start all over again. Now, this certainly beats a 30-day program or inpatient rehab. It's certainly markedly less expensive than that, and you can do this at home, etc. So if you're interested in peripheral nerve stimulation for detoxification from alcohol or opiates, don't hesitate to give the office a call, which is 202-362-4787, and definitely look this up on our website. Thanks, I look forward to seeing you.